Welcome. The Regional Municipality of York is pleased to provide an update on the current COVID-19 situation in York Region. Joining us is Dr. Kareem Kurji, our Medical Officer of Health. He will provide opening remarks, and then we will open questions to the media through our operator. Dr. Kurji.
Good afternoon, everyone. First of all, on behalf of the Regional Municipality of York, we extend our deepest condolences to the loved ones of those that have recently passed. There are some lessons here for us in that several of the individuals are over the age of 70, and a little later I will be having some messages for people over the age of 70. I want to start out by saying that we have had 237 cases so far, with 12 in healthcare workers. We have 2 long-term care homes, and we have 1 home, group home for the developmentally challenged that have been affected. So let's start out with Mark Haven long-term care facility in Markham. There are 22 ill residents there, and 5 of these have tested positive so far. One of the individuals was the 88-year-old male who passed, and this has now been confirmed as a COVID-19 death. In addition to that, we have 43 ill staff, 12 of whom have tested positive. We move over to another long-term care facility, the Yi Hong facility. There are 11 ill residents here, 5 of whom have tested, and we're waiting for their test results. There are 10 ill staff here. We believe that this particular outbreak started as a result of a staff member who tested positive with COVID-19, who is a resident of Peel Region. There is one other ill resident who has now been hospitalized, but this individual was not being attended to by the staff member who was positive, and we are waiting test results. I move over to the group home, Rena Home in Richmond Hill, where 1 resident tested positive and is currently hospitalized. There are 5 staff who were symptomatic and are on self-isolation. And there's 1 household contact, the father, with whom the son had dinner with, and he is in self-isolation. Now I'd like to give you a quick update on some clusters that we have been investigating. For a start, we have 2 gyms in Vaughan, the Bar Body Gym and the Al Palladini Community Center Gym. There happens to be an individual who had been at both of these gyms, or had contact with an individual who was also at the Bar Body Gym. This individual had had lunch with someone from New York who was sick, and we believe that's how the infection got introduced. We have already got 8 positive cases at the Bar Body Gym, and are in the process of trying to identify more cases. The owner at the Bar Body Gym is very cooperative and has been assisting us, and we are working with the City of Vaughan to try and identify the Al Palladini Community Center gym contacts. Essentially, anyone who had been at the Bar Body Clinic gym from March 9th to the 15th, we want them to call us. And anyone who had been at the Al Palladini Community Center gym between March 7th until March 15th, we want them to call York Region Public Health. The other cluster we are investigating is the Austria-Germany ski trip. There were some 55 individuals who went on this trip, and 5 of those have turned out to be cases. We have managed to reach all except 2, and again, this is part of our effort at active case finding. The last cluster that I want to mention is a small cluster at Mackenzie Hospital on the psychiatric floor. There are 2 staff individuals and one former patient who had tested positive. We keep on being vigilant with respect to any intelligence on any other clusters that may have developed. I now like to turn my attention to the trends that we are seeing. In York Region, we are seeing that the travel-related cases are probably declining, although this isn't totally evident. When we look at the local transmission cases, though, there's a mixed picture here. So we want to specially emphasize to the community to continue with the physical distancing. Very important, is together we will get over this. So the advice here would be anyone over the age of 70, please stay at home. Most of our cases have been over the 70. In fact, all the cases have been over 70. Only go out if it's really essential. Try and do your shopping on the internet or online or by the phone, and get friends, family or neighbors to assist you. But make sure you keep 2 meters away from anyone who comes to your home. We are asking that we be a little careful and mindful about keeping our physical distances from our grandmothers as well. And for the general public, we are asking that you stay home as much as you possibly can, and only go out for essential things. Essential things mean health service or health care needs, things like going to the pharmacist, picking up shopping, but otherwise stay home. If you do go out for a walk, make very sure that you're staying 2 meters away from everybody else. In addition, at this time of the year, folks have colds, sometimes flu, and sometimes you don't know whether you got COVID-19 or not. We are asking those with mild symptoms to self-isolate at home, make sure that their close contacts, which are usually household contacts, also self-isolate for 14 days, and then work through the people that you might have had close contacts with 2 days prior to the onset of your symptoms, and get them to self-isolate as well. And of course, if medical conditions deteriorate, seek appropriate medical care. I want to stress that our strategies are threefold. The first one is case and contact follow-up and case identification. This is the bread and butter piece for public health, and it is a time-tested strategy, what we call the containment strategy. The second strategy is one of testing. The more people that we test, the more we are able to shift scarce resources onto those that need our attention in terms of putting rings around them and avoiding community exposures. The third strategy is the whole of society approach, which is the physical distancing, the closure of certain businesses, etc. And hopefully we don't come down to this one, but lockdowns. We do need your assistance, the public's assistance, in continuing to break these chains of transmission. There's no reason why we cannot fight this virus and why we cannot win. Our data seems to give us the impression that we are getting there. So please continue with these measures. And I remind you again about good hand hygiene. Very, very important to keep washing your hands repeatedly. Make sure you don't touch your face. Make sure that if you're coughing, cough into your sleeve. And disinfect surfaces that others might have touched. Even at home, try and keep away from each other as much as you possibly can. Thank you very much. I'll be happy to take any questions.
Your first question will be from Kelly Grant at the Globe and Mail.
Hi, Doctor. My apologies. It took me a little longer to get onto the call, and I missed the first minute of your update. Would you mind repeating the numbers as they relate to the 2 long-term care homes that you mentioned?
Sure, with pleasure. So the 2 long-term care homes that we are following in York Region are the Mark Heaven home and the Yi Hong home. The Mark Heaven facility has got 22 ill residents, of whom 5 have tested positive, and 43 ill staff, of whom 12 have tested positive. We also had 1 death there in an 88-year-old male, and have just had confirmation that definitely was COVID-19 related. At the Yi Hong facility in Markham, there are 11 ill residents, and 5 of whom have been tested, awaiting test results, 10 ill staff, and again, awaiting test results. One of the staff members had been positive for COVID-19, and we believe that she may have introduced this unknowingly, of course, into the facility. There's 1 ill resident who's been hospitalized, but that individual wasn't working with the ill staff member, and the COVID test is still pending.
Follow up?
Okay. I think I've got it here. Just the 98-year-old male who passed away. When did he die?
88. Sorry. couldn't hear the question.
Can you repeat the question, please?
The 98-year-old male from Markhaven, when did he die?
Sorry, I believe your question is when did the 88-year-old man from Markhaven die? That was on Saturday, March 28th.
Saturday, March 28th.
28th.
And I'm sorry, I apologize. Did you say he was 98 or 88?
Oh, he was 88 years of age.
Okay, thank you.
Thank you.
Can we go to the next question, operator, please?
Star 1 if you have a question, please. Currently, we have no other questions.
Thank you very much.
Thank you.
Bye.
For either staff or residents.
Sorry, I didn't get your question again. Would you mind repeating it?
Sure. At the Yi Hong Center, do you have test results back for any of either the residents or the staff?
So we have one staff member, the initial, who we call the index case, who was COVID-19 positive. And that is how we got alerted onto this particular home. This individual was a resident of Peel region and was a staff member, only worked one shift.
Okay. Are you bothered at all by the fact that you have a nursing home where you know there's an index case, you have 11 ill residents and 10 ill staff, and you still don't have any testing results back?
No. Excuse me. It's quite customary for the test results to come back within, about 48 hours or so. But see, we are essentially the way our protocols with Public Health Ontario's, expert advice work is that we have declared this whole facility as being a COVID-19 outbreak facility. So, in general, what that means is all the precautions that are necessary are being taken, right? So staff, for example, have to wear personal protective equipment during virtually the whole day, right? So there are other measures that have actually been put in place.
Okay, thank you.
You're welcome.
No further questions.
Thank you.